So important topics for nutrition science and exam briefing. So first, your chapter, RDA chapter numbers may change. If you have the new textbook, chapter number can may be changed. So for just make sure you just writing down the chapter name. Okay. So RDA, what is RDA? What is the definition of RDA? Okay. The graph, what is estimated average requirement? What is RDA? Okay. The dietary factors that affect RDA. Principles. That's it. That's it. Reference man, reference woman. That's it. That is the only one important from RDA. Next, from carbohydrates, you have two chapters, part 1 and part 2. The recording will be uploaded. Okay. So even if you're missing certain chapters, just check the recording later. So carbohydrates, what is the classification of carbohydrates? What do you mean by monosaccharides, disaccharides, polysaccharides, sugar, alcohols, etc.? Short chain carbohydrates, non-starch polysaccharides. Functions of carbohydrates, very important. Digestion and absorption, just go through it. What is glycemic index? Glycemic load. Metabolism. Metabolism also, just go through it. Hormones that control blood sugar levels, very important. Hormones that control blood sugar level. RDN sources, don't worry about it, don't by heart anything. RDN sources, don't by heart. Then the part 2 of carbohydrates, that is dietary fiber. What is dietary fiber? What is the classification of it? Insoluble, soluble fiber. Effect of this dietary fibers, effect of nutrients, etc. Just read through it. Fermentable fibers, non-fermentable fibers. About the disease conditions, no need to study that. RDA and sources again. RDA of fiber, that is important, that you have to know that 60 gram, not more than 60 gram. That is important. Sources of fiber, no need to by heart. Okay, it's just for your practical approach. You can work as a nutritionist, holistic diet coach, nutrition coach. Okay. After you receive your certificate, you're eligible to practice. You can use these terminologies interchangeably. But not clinical dietitian. You cannot call yourself clinical dietitian. For that, you should have a medical background. Next is your proteins chapter. From proteins chapter, what are proteins? The properties of protein, the three main properties of protein. Classification of protein. What are complete protein, partially complete, incomplete? Essential amino acids, non-essential amino acids. Functions of protein, very important. Functions of amino acids, don't by heart, just go through it, read through it, that's it. Digestion and absorption, important. How proteins are getting denatured within your body, you have to know that. Okay, it is very important, digestion and absorption. Metabolism, just read through it. Factors affecting protein utilization, very important. Biological essays, no need to study. Even if some questions come, just be aware that these are the page numbers. Okay, which part of the chapter, which page number, just be aware of it. Some wrong formulas will be given. You have to choose the right formula. That's it. Okay, you don't have to by heart anything. whatever is your course name on the subject, the only that name that you can use. If it is a holistic coach is the one you have opted for, you have to use that particular name in your practice. And from proteins, the scoring system is very important. Amino acid score, PDCA score, DIAS score, complementary value of protein, important topic. Requirements, you don't have to by heart anything, because in dietetics chapter, in dietetics, every age group has a specific requirement, which we are already covering individually for every age group. So from here, you don't have to mug up anything, okay? RD and sources, no need to by heart. Coming to lipids, what are lipids? Same classification of lipids. What are triglycerides, medium chain fatty acids, different form of fats which are found in your body. Fat is found in your body in form of cholesterol, phospholipids, hormones, ketone bodies, adipose tissue, okay? So how are fat found in your body? That you should know. Fat found in food in form of trans fatty acids, isoprenoids. Visible fat, what are visible fat? What are invisible fat? Vegetable fats. Functions of fat in body, very important. Role of fat in diet. Digestion and absorption also important, but study from the recorded session, okay? In the textbook, if you read, you may get confused a bit, but if you see the image and how I have explained in the recorded sessions, you will understand it better, okay? So the understanding the concept of fat metabolism is important, digestion and absorption. What are essential fatty acids? Functions of essential fatty acids, very important. Deficiency, what it leads to. Sources, supplements that you don't have to study. Recommended RD also you don't have to study. About disease conditions also, no need to study, because disease conditions, separate chapters are there in dietetics. Okay. Next is energy balance. What is the definition of energy? Okay. Direct and indirect calorimetry, no need to study that. Okay, that's just for your information we have explained. For practical purposes, you will not require it. Okay. About calorie meters and all, you don't require it at all. What is total energy requirement? Okay, BMR, basal metabolic rate, read that. Physical activity ratio, physical activity level, understand that, read that. Thermic effect of food, important topic. Resting energy expenditure. Out of that, Mifflin formula is important. Factors affecting physical activity, very important topic. Factors affecting physical activity. Factors affecting basal metabolic rate, again, next important topic. Factors affecting thermic effect of food. RD and sources, no need to read that. Severe acute malnutrition, the entire chapter is very important. All the important aspects in detail we have discussed in many classes. Okay. So the entire chapter is important. There is no part which we can miss out from the entire chapter. Severe acute malnutrition, even the hospitalization, prevention. Okay. The entire chapter is important. We can't cherry pick certain topics here. Macronutrients, about all the macronutrients, okay? What are the RDA? You don't have to by heart. If a question from RDA comes, just go to the textbook, go to that chapter, find out the RDA. You would know, if you have read the textbook, you will know where you will find the RDA. in the tables and all. Okay, just give the answer from that. Okay. Functions of all macronutrients are important. How it is stored in your body, everything is given in the textbook. Okay, but these are the important facts. Just make a separate note out of it. Okay, it will be very easy for you to keep this in mind. Functions of macronutrients: calcium, phosphorus, magnesium. How it is stored in your body. What is the deficiencies that it leads to? Toxicity, what it will lead to. Okay, how it is absorbed. Factors that affect the absorption, factors that affect the metabolism. Hormonal control of calcium absorption, very important. Hormonal control, parathyroid hormone, calcitonin, vitamin D. Okay. Osteoporosis, just read through it. Much questions will not come. We'll discuss that in detail later. Hypokalemia, hypercalcemia. Even for phosphorus and magnesium, what are the functions, how it is stored in the body, deficiency, toxicity. Okay, same thing you have to learn. Electrolytes, the formula you don't have to study. Okay, about the millimole, milliequivalent formula. Don't study that. Don't by heart that. That's just the basic chemistry. Sodium absorption, excretion, metabolism, how to balance sodium. Okay, functions of sodium in the body, very important. Potassium, again, what is potassium? What are the functions it has in the body? Deficiency, what happens? Toxicity, what will happen? Okay. What is it called? Deficiency and toxicity. What is it called? The name, terminologies of it. Chloride as well. How it is absorbed. What are the functions? Deficiency, toxicity. That's it. Water electrolyte balance, almost similar topic you have in both the chapters. But in water distribution, the distribution of water within body, important. Okay. In form of interstitial, extrastitial, transcellular, plasma volume. Okay, all these are important. Functions of water, very important. Requirements, just go through it. Sources of water, two sources are there: metabolic water and the water that you drink. How the water is balanced within your body, important topic. Through thirst mechanism, how kidneys may balance the water. Edema, maintenance of fluid. Dehydration, water depletion or dehydration. Very important topic, dehydration. Water in excess, water intoxication. Electrolytes, you don't have to study electrolytes from water electrolyte balance, because in detail we are studying that in the previous chapter. Okay. Coming to microminerals, all the microminerals from chapter 12 to chapter 14. Okay. How it is the RDA, if a RDA based question is coming, you will know which part of the chapter, which part of the page number, where you have to go, which table you have to search. If you have read the chapters, you would know. Okay. Functions of all microminerals are important. How it is stored in your body, important. Deficiency and toxicity. That's it. This is what you have to study about the microminerals. You can also make a table out of it, make a handmade table, or you can make an Excel sheet of this table. Okay, of all of microminerals. Keep it with you to study and revise for exam. It will be more efficient for you. Okay. Fat soluble vitamins as well. Vitamin A, D, E, K. Okay. What are the RDA? Just remember the page numbers, tables. Okay. Functions of all fat soluble vitamins in detail. Read it. Okay. Storage. Where is the fat soluble vitamin stored? How it is stored, in what form? Okay. Deficiency, what happens in the deficiency of vitamin D, vitamin A deficiency. Okay. Vitamin E, vitamin K deficiency. Toxicity, what happens? Okay, read that. Same applies for water soluble vitamins as well. RDA, know the page number. Functions, very important. How it is stored in the body. Water soluble vitamins are not stored in the body as such. They leave your body with urination, sweat, etc. but deficiency and toxicity, you have to study. The chapter on nutrition and organ health, just read through, understand the concept. It's a very simple chapter, nutrition and organ health. Very simple chapter, just go through it. Antioxidants also, what I have taken in the classes, only that is important. What are antioxidants? What are free radicals? Okay. Sources of free radicals, from where these free radicals attack you. Which are the sources of free radicals that are very common around you and attack you? Okay, that you should know. What is oxidative stress? What are the primary antioxidants, secondary antioxidants? The table is given, okay? And each antioxidants in detail they have discussed, like vitamin E, carotenoids, ubiquinone, vitamin C. But all these in chapters you have learned about each one of them in chapters you have learned, okay? So you don't have to worry about it much. Antioxidant enzymes. Antioxidants and disease, the relation between antioxidants and disease. Okay, how it prevents like aging, how it boosts your immunity, prevents cataract, cancer. Okay, read that. That is important. Antioxidants and disease. Sources, again, no need to by heart. Tables are given. That is more than enough. Nutritional supplements, again, read through it. Very simple chapter, very easy chapter. Nutritional supplements. Just read through it once. Nutrition and infection as well. Simple chapter. Iron deficiency, vitamin deficiency, vitamin A deficiency, how these many deficiencies impact your immunity. Different types of infections, bacterial, viral, fungal. In nutrition and infection, understand the concept of immunity, okay? Classification of immunity, acquired, innate, okay? In recorded sessions, you will understand it in detail. In textbook, it may be confusing for you. Study from the recorded sessions, that will be easier. Effect of infection on nutrition status, effect of infection on nutrients, both have effects on each other. When you have infection, your nutritional status will come down. When your nutritional status is down, you will get more infection. Okay, so analyzing this concept in detail they have given. Just read that. AIDS, nutrition on AIDS, COVID-19. Just read that. And nutrigenomics, understand the the terminology. What is nutrigenomics? What is nutrigenetics? Understand the difference between that, because questions regarding this will come. Okay, what is nutrigenetics, nutrigenomics? Principles of nutrigenomics. Okay, interactions between nutrition and gene. Tools in nutrigenomics, just the tools name. Okay, genomics, proteomics, metabolomics, transcriptomics. That's it. What do you mean by that? That's it. In detail, you don't have to worry about it. Okay, that is too complicated. Then bioactive components on food components on genes. That's it. That's it from nutrigenomics. So all the important chapters from nutrition science, is it clear to all? I can't repeat the entire chapters and important topics now. The recorded sessions will be uploaded. Please check the recordings. In dietetics, it is much more easier. Menu planning, you have to understand what is food exchange groups, okay? Determinants of food choice. Why people have specific choices in food, okay? That is determinants of food choice. What are functional food, okay? Different effects that food have. Antioxidant effect, detoxifying effect, anti-inflammatory effect, hypocholestemic effect, hypoglycemic effect, antibacterial effect, digestive related effect, immunopotentiating effect. Okay, these are the different effects food have. Okay, understand that effects. 5 food group system, 4 food group system, okay? Food pyramids, my plate, my pyramid, Mediterranean diet, the benefits of Mediterranean diet, okay? Planning the balanced diet, steps of it. Tables, you don't have to worry about it. Principles of planning diet, that is important. Principles of planning diet is important. Steps involved in planning diet, just read the steps because the steps involves understanding the table. Tables you don't have to by heart, okay? For theory exams, MCQ will not be asked. Adjuncts to diet therapy is a self-study subject, a topic that is not important. Then all the adults, infants, preschool children, all these chapters, nutritional and food requirements of different age groups which are there in the textbook, only the requirements you have to study. Okay, only the requirements. That is the amount of fat, protein, and minerals, vitamins, fiber that they require. Food and food as well as the nutritional requirement. Okay, that you have to study. From all these chapters based on age group. Focus more on expectant mother, lactating mother, infants. Nutritional anemia, very important chapter. All the important topics which you have to focus. I'll say that the table, causes of anemia in different age group, important. Types of anemia, very important. Iron deficiency anemia, the entire topic is important. How it happens, okay? What are the diagnosis, stages, clinical findings, treatment, okay, of iron deficiency anemia, everything you have to study. Megaloblastic anemia, B12 deficiency, just go through it, clinical features and all. Pernicious anemia, clinical features, everything. Folate deficiency also, why it happens, clinical features, treatment. Hemolytic. Iron deficiency anemia is the most important topic there. Majority of the questions may come from it. Prevention of anemia as a whole, prevention strategies, diet, supplementation, education, fortification, okay, all these topics are important. Diet therapy, understand glycemic index, glycemic load, dietary supplements, diet and inflammation, prebiotics, probiotics uses, artificial sweeteners, stevia. About stevia, just read properly because it's like nowadays a lot of talk about stevia is being going on, as well as monk fruit. Okay. Effects of drug and nutrient interaction is important, but only for students who are from a medical background. For your practice, that is important. Students who are not from a medical background, you don't have to worry much about the effect of drug and nutrition interactions. Okay. That's more of a clinical nutrition part. Personalized nutrition, just read through it. That's it. Therapeutic diet, immunonutrition, different types of hospital diets, clear diet, full fluid diet, liquid diet, soft diet, normal diet, okay? Enteral feeding, parenteral feeding, the difference between enteral and parenteral feeding, different types of enteral feeding, different types of parenteral feeding, types of food given through enteral feeding, okay? Blenderized feeding, elemental diets, natural liquid food, very important. TPN, total parental nutrition, just understand TPN. Many tables are given. Don't worry about it because that's the clinical nutrition part. Okay. Questions will not come from that. But understand what is TPN, total parental nutrition. That's it. Formulas also, don't study about formulas. That is only for doctors to understand. Complications of TPN, you can read that. Refeeding syndrome, that also important. nutrition and wound healing, pre and post-operative nutrition, nutritional support in burns patient. That's it. Clinical questions will not come. Infections and fevers, dietary infections and fevers, all topics are important. Okay, the principles applied here. Okay, for different infections, they have given some clinical features and treatment, dietary treatment. All of this, medical treatment, medical management based questions will not come. Only dietary and nutritional management questions will come. Okay, from all these chapters. Obesity and underweight as well. Medical management, like some tablets are there to which can cut off your hunger. So these questions will not come. Only medical, only nutritional and dietary management based questions will come. Clinical based, pharmaceutical based questions will not come. AIDS nutrition, that is important. Diet in obesity and underweight, and study the St. John and Mifflin formula, Broca index, waist to hip ratio, Ponderel index, BMI, body weight, theories, fat cell theory, set point theory, role of hormones, very important. Causes of obesity, the etiology. Types of obesity, juvenile onset, adult onset. Treatment, the strategies of treatment, in which diet therapy, physical activity, stress management, weight loss surgery, just read that. Pharmacotherapy also, just read it, but you don't have to by heart it. Dietary guidelines, read that properly. Complications of obesity. Weight management guidelines for dietitian. Then cardiovascular disease, again, the clinical effects, cause, risk factors of cardiovascular diseases, that is most important. Just study that table, that is enough. Risk factors table, category 1, 2, 3, 4. Okay. Role of fat, just study from the recorded sessions, because in detail, if it is given in the textbook, it is confusing. Just study what is explained in the recorded sessions, that is enough. Saturated fatty acids, cholesterol, trans fatty acids, triglycerides, how they contribute to cardiovascular diseases, just read that. Treatment, again, dietary management is what you have to focus more on. Drugs, no need to focus more on that. Exercise, yes. Smoking cessation, stress management. Okay, these are the principles of management that you have to focus, except for drugs. Functional foods for cardiovascular diseases, very important. Dietary guidelines, read through it. Questions will come. Hypertension, also just read through it. All the specific disease conditions, just read through. What are the food that can prevent cardiovascular diseases in general? That is what you have to focus more on. Diet, stress management, physical activity, exercise. Drugs, you don't have to study about it. Gastrointestinal disease also, all topics are important. Whatever is covered in the content of the topics covered in recorded sessions, only focus on that. Medical management, no need to focus on any disease conditions. Liver and pancreas as well, all topics except pharmacological management. Diabetic mellitus, all topic, difference between type 1, type 2. Symptoms, very important. How do you diagnose a diabetes case? Very important. Treatment, again, lifestyle changes, food exchange list, Daphne chart. Factors influencing glycemic index, important. About the drugs, no need to study. Oral hypoglycemic drugs, don't study that. Exercise recommendations, you can read it. Complications, very important, of diabetes. Prevention of diabetes, important, dietary supplements. Kidneys also, all the diseases except for pharmacological management. Acid ash diet, alkaline ash diet, low oxalate diet. Food sensitivity, what is food allergy, what is food sensitivity, difference between that. Food reactions, foods involved in sensitivity, symptoms, how do you diagnose it, treatment, intolerances, FODMAP. FODMAP based questions will come, FODMAP, FODMAP. Then errors in metabolism, just the concept of it and the types, that's it. Okay, management and all, when you understand the concept, it will be clear. Okay, errors of metabolism, phenylketonuria, they have given long list of management, no need of that. Okay, just the dietary management of phenylketonuria. And what is phenylketonuria? That is important. That you have to learn from the recorded sessions. That is more than enough. Okay. Cancer also, all topics, diet in cancer, risk factors of cancer. Okay, environmental factors, dietary factors that leads to cancer. That is important. Symptoms, how to identify it early stage. A mnemonic is given in the recorded sessions. You can refer that. Systemic reactions in cancer. Nutritional problems of cancer therapy, very important. Nutritional problems of cancer therapy. Dietary management, important in cancer therapy. Prevention as well. Then some special diets, all topics, the small chapter. All topic is important. Then dietitian, it's a self-study chapter. You have to study on your own. It's more about your registration and nutritional assessment, ethics, responsibility. Okay, that you have to understand the concept on your own. So a sample question you can see here. Tomorrow also we'll discuss sample questions. This is just 2 examples here. So DIAS score, a question can come like this. What is the full form of DIAS? Which do you think is the correct answer? You can reply in the chat box. Yeah, it's the second option, digestible indispensable amino acid score. Okay. Second question, water intoxication leads to. What does water intoxication lead to? It will definitely lead to overhydration of cells, hyponatremia, both. Okay, so the option will be both, option 3. Okay, so these type of questions will come, expect these kind of questions. Okay.